My name is Wolfgang Honninger. I'm the director of the Department of Urology, Innsbruck Medical University. The department consists of 2 adult wards, each 27 beds, and of 1 pediatric urology ward. Also within the department there are 3 scientific labs, and they are mainly dealing with prostate cancer and cancer immunology. Within the department we have the European Prostate Cancer Center. Within this center we can offer all diagnostic, all therapeutical modalities which are internationally available to date. With high quality diagnosis, with high quality therapy, we try to reduce overdiagnosis, overtreatment, and we also try to reduce the side effects of surgery and of radiation therapy to a minimum.
To develop new surgical techniques, at the one hand you need good theoretical background in a center of academic excellence. On the other hand, you need good infrastructure in terms of patient workup, diagnosis, treatment, operative surgery, and then follow-up. And Innsbruck Urology gave us the possibility to develop new techniques above the established techniques. Being able to deliver a quality medical service, over and above that we were able to revolutionize male incontinence surgery, developing a new male sling for post-prostatectomy incontinence.
We are focused here on the resistance to chemotherapy in prostate cancer. Chemotherapy is normally used in prostate cancer after endocrine therapy. However, unfortunately, the duration of effects of this therapy is rather short. For this reason, we have to understand the mechanisms by which prostate cancer cells become therapy resistant.
We're trying to identify markers which would allow us to identify patients who would respond to a certain therapy and those patients who would not respond, kind of personalized medicine. And of course we want to try to improve the prostate, and in my case also breast cancer therapy, by combined treatment approaches which are combined the standard therapeutics which are already available and some new targets which we are identifying here.
One of the most intriguing issues in cancer research is the use of appropriate cell culture models which reflect the characteristics of human tissue. And so the main limitations of using two-dimensional cell cultures is that the cells lose relevant properties such as cell differentiation and polarity. In one of our projects we have established a 3-dimensional technique. We use these 3-dimensional organoids which we consider that they better represent human tissue to test, for instance, the efficacy of different drugs, or as it is the emphasis of the PhD thesis of Anja, to investigate metabolic changes which occur in prostate cancer cells.
For quite a long time, the success of immunotherapy was based on telling anecdotes, stories from individual patients who had a favorable course. But now clinical trials have really documented and cemented the potential of immunotherapy. And for example, the renowned Science magazine has named cancer immunotherapy the breakthrough of the year 2013. So I think this is really promising.
It pushed the whole field, and it's very promising that the work the single labs do all over the world. So it's quite interesting. Yeah.
There is definitely a big difference between adult urology and pediatric urology. The environment is very important. You need to have a whole spectrum of logistics. You need specialized nurses, you need a specialized team in the operating room, you need a specialized team in the outpatient department. The facilities have to focus on the special needs for children. That's very important, and it's not possible that when you are dealing only with adult patients that you can do the other day operations in the pediatric field. So that's the reason why within the European Union back in 2001 pediatric urology has become its own subspecialty that is officially recognized now. We are mainly dealing with congenital malformations. And there is, in most of the cases, a need for surgical correction of these malformations. So the field of surgery is completely different from the field of surgery in adults. They are mainly dealing, for example, with cancers and things like that. So we are sort of reconstructive surgeons. We are trying to reconstruct nature as good as possible in order to avoid any subsequent consequences due to the congenital malformation. So that's our main field, doing reconstructive surgery in those kids.
One of our focus for the last decades of research we are doing here is the biology of the androgen receptor. And the androgen receptor is the main target for treatment in prostate cancer because the prostate tumors are dependent on androgen hormones. And we have contributed to the understanding how prostate tumors become resistant to these kind of drugs that inhibit the androgen receptor. And based on this, new strategies and new drugs have been developed, which have been introduced into treatment recently. The people working in the lab here are biologists, biochemists, pharmacists and medics, and many PhD students, master students, bachelor students who perform their thesis in this lab, working in research projects, and we try to offer them stimulating environment, interesting research topics, and support for training and performing her experimental work for their thesis within international research networks, which is a very important aspect in top research nowadays.
What's unique on this department is that we cover the entire spectrum of adult urology, so that we can do all the things of urology, for instance andrology or urologic oncology, all in one department at one place. And this all in combination with high quality labs where the aim is translational research.